Good morning, ladies and gentlemen. Thank you for your attendance this afternoon. My name is Phillip Frazier, and I'll be speaking with you today about the increasing rise of autism in children. And I will also speak to you about early intervention and treatments that can help your child. How's everyone doing today?
Good.
Okay, we got a live audience. All right. This is a very profound topic for me because I too have a 5-year-old son that has been affected by this disease. I implore all parents to pay attention to your children. Autism usually manifests within 1 year of the child's life. I was nervous about first getting my son screened and tested. But remember, knowing is half the battle. From knowing, I can also handle the effects of the autism within my child. There have been cases when the child has moved out of the autism category but still remain with certain signs of ADHD to some degree. And if you're worried about your child's development or lack thereof, have your child screened because autism is on the rise and is the second most common developmental disability after mental retardation. And intervention can also involve behavioral treatments, medicine, or both. While outcome of early intervention varies, all children benefit. The intervention focuses on core areas affected by autism. Treatments also include physicians, speech and language pathologists, occupational therapists, and treatments help young children with autism develop to their full potential. The primary goal is to improve the overall life of the child. I will stress again, early intervention by screening and a clear diagnosis is pivotal. Don't be afraid to seek a professional. I would briefly like to speak with you about a young lady named Michelle Sedelia. She was a happy-go-lucky young teenager and had her entire life ahead of her. She developed autism and many other medical problems in the immediate aftermath of her MMR shots, which is the mumps, measles, and rubella shot. There have been concerns about the MMR vaccine being linked to the increased risk of autism. Michelle's lawyers used advanced scientific and legal arguments that the combination of mercury-containing live virus vaccines substantially contributed to her life-threatening medical conditions that she has now. Her case is still pending. There are also programs and schools that you can enroll your child in. One program is called the Growing Minds. This program has one of the most experienced team of professionals of the field of autism today. The founder, director, Stephen Wirtz, has over 30 years of experience working with children, adolescents, and adults that fit in the autism spectrum. This program improves language, communication, social interaction, and behavior, as well as increasing their academics. A big reason I'm a supporter of this program is because it teaches the parents to provide the most effective education and treatment for their children using the best methods available. And ladies and gentlemen, I would like you to take a look at the CDC statistics. On this data sheet, the CDC has identified that in 2008, that there's 1 in 88 children that have the autism disorder. In 2000, the CDC identified that 1 in every 150 children was affected by this disease. This is a dramatic increase in this disease. This disease affects is 5 times more common in boys, 1 in every 54, and it's 1 in every 252 in girls. The CDC also states that 1 in every 6 children in the U.S. have developmental disabilities in the years of 2006 to 2008. By this comparison, more children are affected by autism than diabetes, AIDS, cancer, and Down syndrome combined. In closing, I would like all of you out there to know that and understand that this disease is on the rise. There needs to be more research about what causes this disease. And if you have any, if you're questions about your children being screened, you call a medical practitioner because early detection and intervention is pivotal to your child's developmental success. Parents, utilize these services because remember, your child's life should be your biggest investment. And I would like to thank you for coming out today, ladies and gentlemen.